Everyone. I am Dr. Carolyn Peart, a primary care family medicine physician. My office is actually over at 375 English Street in Rivervale. Okay. So our talk today is really going to be about screenings. So we're going to go over all the screenings based on age, screenings that you should get when you go to see your primary care doctor. And then I'm also going to take questions, but I want it to be a little bit interactive. So if in the middle of the presentation you want to stop and ask a question, then please feel free to do so, okay? So this is our talk for Women's Health Month. Any questions so far before we get started? No? Okay. So health screening through the ages. So it's important to make sure that you're taking care of health, and that kind of starts with your health risk. And of course, your recommended screenings at each stage in life. So screenings tend to differ based on what conditions you may have. Overall, this would be for like a person who's healthy, no other medical conditions. This would be like their baseline screening. But if you have other conditions, this is going to change. So at most, you want to make sure they're getting like your yearly physical, no matter your age. You want to find a doctor, which I'm sure all you already have, that you actually like, one that you can talk to, one that you're going to be able to work well with. And then your yearly physicals, that's the best way that we can detect any changes in your health before they develop into like a bigger issue. So you want to know your history, find out what conditions run in both sides of your families. That's really important. And then you want to share that with your physician, both your personal as well as your family history. And that way we can sort of help to determine like what's your risk level for any particular condition or disease and what screenings that you may benefit from. So I'm going to pause here. So it's not just my presentation, it's our presentation. So I'm looking for some participation. Any questions so far? Anything you want to recommend? No? Okay. You guys are fairly quiet. We are going to go over all of that. We're starting, so I call this back to the basics because we're starting from the beginning and then we're going to build up. So we're starting from like the 20s. And then we're going to build up all the way to the 60s, the 70s, or even like the 80s. So a few things that I recommend is making sure that you maintain a healthy weight because you want to keep off the excess weight. That helps to protect you and also help prevent you from developing some long-term conditions like diabetes, sometimes sleep apnea, blood pressure, arthritis, or even other conditions. So you want to maintain a healthy weight. One of the things I forgot to mention is if you guys want to just get a handout, and you can sort of follow along. So if you want to just take it and pass it along, so you don't have to take as much notes. All right, if you smoke, you want to quit smoking because your risk of cancer increases with smoking. And then certain other disease like COPD. So you want to quit smoking because this is going to decrease your risk of those type of diseases, okay? So what to expect? So what do you expect? And I'm gonna ask this question to you guys. What do you expect when you go and see your doctor for like your annual physical? Like what are you expecting? I'm sure we've all had an annual physical here. Anyone?
Well, when I go to see my doctor, I always ask her, what do I need? Do I have all the shots that I need?
Okay, good. That's it. Yes. Okay, good. Yes. Anyone else? Like, what do you expect? Do you ask your doctor these questions? No?
I expect her to tell me what
But do you ever ask? Okay. Anyone else? Yes. When you need it. Okay. Oh, what you're missing? Yes. Well, now with technology, we get reminders too. So we certainly can remind you of what you're missing. But anything else? Anyone else? Now, sometimes depending on where you're from, because sometimes culturally you might not ask the doctor or you might not mention it. You might just wait for them to tell you. But I think it's a good idea sometimes to discuss it. Maybe have one or two questions that you probably want to ask them when you go, for your annual physical or just if you're going for like your routine. So, what to expect? So, of course, we're going to go over your general health. um, we're going to talk about all your screenings that you need. So, we're checking your blood pressure. Of course, that's part of your cardiovascular health screening. We're doing your blood work, so we're screening you to see if you have other conditions. Is there any diabetes there? Um, and then, of course, if we need to send you to get and we're going to go over that, your mammogram, your colonoscopy, then we're going to get all that done. So it depends on who your doctor is. They will generally go over what's going to be done. And if it's not, if they don't get the chance to go over it, then you certainly can ask, the question. Because you have the information now, so you certainly can ask, okay? And you can ask, why do you need, these screenings? So why are these screenings important? Anyone? This is the basics. This is not. But why is the basics? By the way, why is the basics important? Why are we even talking about this? Yes, preventive care. Why is preventive care important? Yes, yes, yes. Anyone else? True. Anyone else? No. Early detection, yes, it's up there. So prevention, of course. If we can prevent something, why not? Do we want to be fixing it? It probably takes more time, more money. So, if we can prevent you from developing that illness, or if we can catch it and treat it early so that it doesn't get worse, then that's what we should be doing. So, yes, early detection. We know early detection is important. Why is early detection important? And what is it important for? Like, give an example. Yes, yes, I agree. Anyone else?
Yeah, but something like, if you have a colonoscopy, if they see a polyp,
Yes, we know. Yes,
it's 100% preventable because you just.
exactly. So that's why early detection is important, especially for cancers. Because when you catch it early, you certainly can, take care of it before it gets worse. So that's very, very important. Also, a comprehensive evaluation where we're going over everything, head to toe, all your screenings again, your health monitoring, and your health education. So, if you're armed with all this information, then that's going to help to improve your overall health. Okay, you're going to know what questions to ask, what screenings that you need, and I'm sure you guys are all going to keep up with your screenings. Any questions so far? So, sure. Awesome. Mm-hmm. It is. Yes. Yes, it does remind you when you have your screenings. Um, but do you go, you schedule and go and get all those screenings? Yes, no? Not just, yes. Good, good. We want to make sure you go because, we do have a lot of persons that they get the information, but then you don't see them. Yes. Go ahead, ma'am. You can ask your question.
Some
Mm-hmm.
tests, when I see my chart,
Yes.
metabolic panel,
Uh-huh.
that list of stuff, half the stuff I don't even understand because it
Ve-
tell you what
Mm-hmm.
the market is,
Mm-hmm.
and sometimes you wonder, am I too far this way or am I too far that way?
So you know what? That's a very good point that you made because that's a question for your doctor. So that's for us to interpret and to to tell you. So what you want to do if that happens, you probably want to make an appointment to see them to go over those results and ask them to explain because they will explain, of course, in layman's term where you can understand it. Yeah. So of course, my chart now you have. Don't,
At your age, that's okay.
but it's good that you ask because you want to know. So that's really good that you ask. Now, uh-huh. The normals, okay. And for the most part, now with my chart that you can message, we're fairly good at getting our staff or even responding to the messages ourselves. If you Just don't message with too many questions. But if you have a lot of questions, then you should come in. But if you have like one or two, you certainly can send a message. But send a message. They'll tell you to come in. Just go ahead, ma'am. Uh-huh. Yes, that's true. Mm-hmm. Yes. And yes, yes, yes. And that's what's, with the Google, it can add a little bit of anxiety because then you get so much information and you may think all of these things apply to you when they really don't. So with that, I would say maybe wait until you hear from them, or it's okay to send a message if you haven't heard from anyone in a few days. If it's something that's significantly abnormal, most of the time someone will call you. But if you haven't heard, like let's say a few days pass and you haven't heard, you can always, send a message or call the staff or go in person. That's probably the best way, set up an appointment, go in person for them to go over those results with you, okay? But it's so true. Sometimes the labs come out at all hours and we don't see them all the time. So you certainly see them before we see it. Yeah. Any other questions as we go along? So, yes, ma'am. Yes, ma'am. Feel free to ask. Oh, yes. We, uh-huh. Yes, so we're gonna talk. Did you get one of those handouts? Because we're gonna talk about that information is there, but we're gonna talk about that, but we didn't quite get to that yet. So hold on that one because we're gonna answer that one a little later, okay? Okay. So 20s and 30s. So 20s and 30s, this is the fun age. This is really the age where you're at the peak of your physical health. We probably can all recall our 20s and 30s. Um, so this is really an important age where you want to really stay healthy. You want to start all these habits earlier, not necessarily later. So that's an important age. For women, especially at this age, you're really probably focusing on your reproductive health. So, are there any menstrual issues? If you're considering dependent, again, this is the 20s and 30s, any, family planning, like pregnancy, you want to talk to your doctor about that, birth control or screenings for STS. So, you want to really establish the good habits around this age. And, at this age, you're feeling good, but because you don't have any ailments, that doesn't mean you shouldn't still see your doctor. You really should be still getting your annual physical and even still getting your well woman exam, okay? Any questions for 20s and 30s? I know we have nieces, granddaughters, daughters, so you can take this information and share it with them, okay? So I put this picture here, but this picture probably should have come after the next one. Breast self-awareness. So nowadays, depending on the guidelines you're looking at, they might not recommend doing a breast self-exam, but you still want to get familiar with what feels normal to you. In that way, certainly, if there's anything that just doesn't feel right, you can certainly go talk to your doctor and see if you need more additional. So I certainly recommend what's called a breast self-awareness exam monthly still, so you can get familiar with what feels normal for you, okay? All right, so we talk about yearly physical, a clinical breast exam. A lot of times the GYN will do this one. Your routine blood tests, blood pressure, of course. You'll get your cholesterol screening or even blood sugar testing. But the blood sugar test at times might be also on risk factors or also if you're in the overweight category. So it just really depends on who your physician is. For the most part, I've seen most doctors are doing these like for your annual, okay? PAP or cervical cancer screening starts at 21 years old. Every 3 years at that, if it's normal, like if it's abnormal, then certainly your GI would tell you when to come back. But if it's normal, you can go every 3 years. And at this age, your routine vaccines are gonna be mainly like if you need a tetanus every 10 years or HPV, which is up to 26, but now they've extended it to 45 with a discussion, of course, with your doctor, okay? STD screening if you're at risk, and a skin screening annually. A lot of people don't do this one. believe it or not. And skin screening, yes. Yes, you should be seeing your dermatologist to get a head to toe. Yeah, pardon? Dermatologist, yes, you should see a dermatologist. A head to toe skin screening, because people of all races can certainly get skin cancer, and it's one of the number ones. So you certainly should. And we'll touch on that a little bit later, but if you have moles or you know the skin changes, you should keep an eye on it. Is it changing in size? Is it changing in color? And you should bring that to their attention, okay? Any questions for 20s and 30s? No? So you guys get your skin screening or no? I tell everyone this to make sure they get their skin screening. All right. Mental health screening, that's also important. All right. So anxiety. So, we have these guidelines that we follow, but guidelines are really, of course, it's not a one size fit all. Everyone is different. But recently, part of that guideline is for routine screening for anxiety disorders. It's really a questionnaire, and it just goes through a number of questions over a two-week period. It gives you a score, and then it kind of tells us, okay, if there's any anxiety there. And then with that information, we can provide you with the resources. So if you need to see someone in behavioral health, we can provide that. If it was a case where you benefit from medication, we can provide that. So believe it or not, that's all part of your annual physical that when you go into office. Now the depression screening also, you probably go to the office and someone either at the front desk or one of the MAs will ask you, over the last 2 periods, do you feel down? Do you feel depressed? That's also part of it. It's the same type of questionnaire. We go through a list of questions, you give us a score, and then we can provide you with the resources or the referral if you need it. Any questions so far? It, yes, it could. All right, so great question. Anytime you go to your doctor for your annual physical, this mental health screening should be done. At minimum, the depression screenings should certainly be done. The anxiety screening was added recently, but those screenings will certainly be done by them. It doesn't have to be done by the behavioral health or the psychiatrist, but it should be done. So remember, when you go in for your annual physical, it's really screening, so we're trying to, yeah. So it depends on how you respond. If you said yes, then there's a more detailed questionnaire that follows that. So it's really, again, it's not a one size fits all. So let's say, for example, you said, yes, I've been feeling down, depressed in 2 weeks. Then there are additional questions that will follow to sort of evaluate you. And now with technology, our system is so good that it might even tell you, hey, once the score is there, it tells you like, okay, this person should be referred. It makes that recommendations for you. Oh, that's a good question. So, so great question, because that questionnaire comes after. It asks you it might have like 9 or 10 questions, and it will ask you, are you sleeping more? Are you sleeping less? Are you eating more? Are you eating less? Are you doing activities that you normally enjoy? So it goes through all of that and give you that score, okay? All right, so we're gonna move along. Just remember, these build on each other. So we're going to the 40s and 50s now. So 40s, of course, additional screenings are added, and as we get older, more and more screenings are added, okay? So 40s, 50s, we're thinking about perimenopause, the menopause, and so, this is a time period where, we're having changes, and this period can last anywhere from 6 to 10 years. So it can start like late 30s or early 30s and just go on. Very general symptoms. Sometimes you might be having the hot flashes, a change in sleep, fatigue, mood swings. So just a number of symptoms. Now, you don't have to really, I always say this to the women, that you really don't have to suffer through this alone. You can talk to your GYN or even your primary care doctor and see what options there are, because there is a way to manage this, whether with hormones or non-hormonal therapy, or even some lifestyle changes like exercise has been shown, dietary, eating healthier, certainly it can benefit from that. And the average age for most women is about like 51 that it would start menopause. A lot of times it goes in line too with the women in the family. So let's say for myself, like maybe if my mom went at 50, then I probably can expect around that age. Okay. Any questions? No questions? Any questions? No? Okay. All right. So moving along to the 50s, which is a magic number. And the next time we'll go over all the screenings for both 40s and 50s because that's when you're getting more, even more frequent uh, screenings then, okay? So similar to some of what we had earlier, cholesterol screening, that's to evaluate more cardiovascular health, of course, with your blood pressure. Colon cancer screening. Now, we had a question over here about the colon cancer screening. All right. So now your question come up, and your question was, do we have other methods of screening? All right. Why did you ask that question? I'd like to know. I'm a little biased, by the way, when it comes to colon cancer screening. But what are you scared of? Oh no. you have that's probably the best sleep you're gonna get, but no, we're being recorded. See, this young lady agrees with me, the best sleep. But see, look, you have a lot of support here. A number of women tell you that's the best sleep. But yeah, yes, she's correct. But yes, there are other tests. So yeah, see? All right. So the colon cancer screening, the age got lowered. We start at 45 now, partly because we're seeing more colon cancer in younger people. You have options for testing, but I can tell you, I'm very biased. I prefer colonoscopy, but I'll tell you what the other options are. Now, you want to keep in mind, too, your family history. Because if you have a family history of colon cancer, let's say you have a brother, a sister who had, or a mom, and I'm going to say, for example, they had it at 30, well, 45. Let's say 45. Your screening actually starts 10 years earlier. So 35 is when you're getting your screening. And I would certainly say I would consider your risk a little bit higher, so I'd recommend a colonoscopy. Now, when we do a colonoscopy, it's both diagnostic and therapeutic. What do I mean by that? Your doctor goes in, they look, they see something, a polyp, they're going to remove it right away. Yes? Anyone agree? Yeah, so they're going to remove it, right away. If, depending on the type of polyp, so let's say everything was good, there's nothing there that's abnormal, they might tell you to come in 10 years. It depends. If they let's say if they found something, depending on the number again of polyps, they might tell you 5 years or 3 years. But it's not something you have to get all the time unless, of course, you're high risk, okay? You have certain risk factors and your screening changes. Now, there are other options. There is the DNA test called the Cologuard. Anyone heard of the Cologuard? Yes? Yes, you've had that one? All right, so the Cologuard, that one is the stool test. It's looking to see, it tests like the DNA, if there's any, cancer, any blood. If it's normal, you go back in 3 years. However, if the Cologuard is abnormal, what happens? You gotta do a colonoscopy. So might as well you do the colonoscopy. If the Cologuard is abnormal, you have to do a colonoscopy. So young people, if I have a 45-year-old come in, and because I'm biased again, I generally recommend colonoscopy. But if they say, no, I don't want any colonoscopy, I'm afraid to get it, I might say Cologuard if they're low risk. So there's no family member that had colon cancer at a young age. Okay, fine, you can get a Cologuard, that's good for 3 years. Now, there's also the blood test, not the blood test, sorry, the stool test where we look for blood in the stool. That one you could get once a year. But again, if that's abnormal, what happened? Colonoscopy. Then I did not add this one to it, but there's something called a flexible sigmoidoscopy. But that looks more at the lower part of the colon. So the colonoscopy is going to look at the full length of the colon, right? But this is only going to look like at the lower part. So that's 5 years. But if that's abnormal, it's the same, it's a colonoscopy. So I always encourage patients, just get your colonoscopy. So endoscopy is more for like upper, if you have, let's say you have like any ulcers or the doctor is concerned for, acid reflux over a long period of time, he may. So that's more like a case by case, but it's not like something you recommend for screening. Not doing them together. That's actually going to be based on your physician if they want to do that, or if they have, you might have an issue where someone else might not have and they want to, complete that testing. But it's not something that's part of like your annual screening that you must get every year unless there's a reason for it. Yeah. So screenings kind of vary because, as I mentioned earlier, let's say you have strong family history or you had a lot of polyps, then they might want to do more frequent screening or even screen for longer time. Whereas maybe a healthy person who doesn't have any other condition may cut off at, let's say, 75 years old, they might want to continue. So that's all going to be based. That's, case by case basis, okay? All right, mammogram, we start at 40. Depending on the guide, I won't confuse you, so we'll just stick with 40 because different guidelines sometimes have, different recommendations. You may see, based on certain age, you may see like every 2 years, but for now, most people are doing once a year. Now, the same with with breast cancer screening is that if you have family history, like mom had breast cancer at a young age, your screening might be a little bit earlier. It just really depends. So mammogram starts at 40, and then it's going to continue on, and we're going to, go through on when you can actually, stop, or if you want to continue, you can always discuss that with your doctor. You will get your A1C, which is the blood glucose testing, as part of your, your routine lab test. So we talked about mental health, as well as the cervical cancer screening. Now, when you get to the 50s, the vaccine recommendations also change because now you need to get your shingles vaccine. So I hope everyone here got their shingles vaccine. Oh, thank you. Yes. Why not? You didn't get it. All right. So you should get your shingles vaccine because chickenpox comes back when you're older as shingles. So you want to get your 2 doses of shingles vaccine. All right. So recommendations for pneumonia change. It used to be 65. But for someone who had maybe some other conditions, asthma and so on, you may get earlier diabetes. But now all across the board, 50, they're recommending for us to get our pneumonia vaccine. You probably may have gotten information in the mail about that or somewhere, but now it's actually 50. Yes, so 50 for the pneumonia. Your Tdap every 10 years, and then, of course, your seasonal flu vaccine, okay? Any questions? Yes, please.
Shingles shot. It was such a painful reaction.
Really?
Months and months and months.
Oh, I'm sorry to hear that. What? Oh no, I'm so sorry to hear that. Did you discuss that with your doctor? Yeah, I would bring that up to them. I am so sorry to hear that. Yes, go ahead.
I have a question. Like she said, she got the first one and she didn't go back. If she was to get you to start all over.
It depends on how long. Yeah. So if it's like 2 months, 6 months, you can definitely get your second. But certainly, if it's longer period, you may have to go back in and get. I would discuss it, with them. Now, is it a reaction, like an allergic reaction, or what? Not to. Oh. Oh no. And what? I am so sorry to hear that. Yeah. Now, it's everybody, again, everyone is different, so that doesn't mean you shouldn't get your vaccine. You should still get your vaccine. That's not a normal reaction that, certainly you may have with any vaccine, you may have a little discomfort at the site that it was administered, but, from like what you're saying, I wouldn't expect something like that. Yeah. So our skin screening we talked about. One thing we forgot to mention in our 20s and 30s is your dental and your vision. Your dentist twice a year, Of course, your vision, maybe more frequently if you have vision problems, but if you have normal vision, then it doesn't have to necessarily be yearly, but I always ask at least twice a year. Okay? Any other questions or? Oh, the 60s and 70s are coming up. you, yes, ma'am, go ahead and ask.
How many times do we get a vision exam?
A vision?
Vision.
You should, if you have good vision, you should at least be going every year or even, every 2 years. But if you have some type of vision problem, you should be going a little bit more frequently. But depending on your condition, but let's say you have no vision problem, at least once a year, I certainly recommend for my patients to get. Okay? Any other questions? Yes, ma'am, in the red. You want to ask them? If you're diabetic, you definitely should go yearly. So let's say the lady who just asked the question, you have spectacular vision, 20/20 vision, no problem. I would say at least try to get it within that 2-year period. You don't necessarily have to go every year. If you're diabetic, you must go once a year for your vision. Even my other patients have glaucoma, any problem with your vision, I say you should get it checked out. Okay? But diabetics, yes. That's a very important point because if your diabetes is not controlled, it certainly can affect your vision, yes. Any other questions? No? Yes, no? Okay, so lifestyle tips, strength training, because as you enter your 40s and 50s, you start to lose muscle mass. So you want to add a little bit of weight training to your workout. That's to help prevent you from losing the muscle mass. But of course, if you have any medical conditions, any heart problems, you want to get a little bit of clearance first before you start any new exercise routine. So I talk about strength training. It doesn't have to be you're going to the gym and lifting, heavy weights. Any type of resistance training works, whether it's with resistant bands, certainly. If you want to walk and take some light weights with you, that's also okay. But some type of, weight or strength training or resistance training will definitely help to maintain muscle mass. Questions? All right, we're getting to the 60s, still 50s, 60s. We're sort of building. A lot of this is repeat that we talked about before, like the breast self-awareness monthly. But now we're getting into the bone density screening. Everyone's getting their bone density screening done every 2 years. Okay. At what age did you guys start? 50? Good. Some people, we can start earlier too. It depends on if you have risk factors. Let's say you were on long-term steroids, you certainly should be starting earlier. Family history of osteoporosis, fractures, then you certainly can. If let's say there's no risk factors for it, you can wait till 65. I almost never let my patients wait that long. If we could get it done a little bit earlier, or if they have some risk factors, I certainly, will go ahead and get it done. Any questions for the bone density? No? All right. Lung cancer screening. So lung cancer screening for those who are of course, smokers. And smoking, of course, you're at high risk of lung cancer. So that starts 50 to 80 if you've had a 20-pack year. Even for those who have quit, if it's, you've quit within the past 15 years, we would do low-dose CT scan for lung cancer. That's something you want to discuss, though, between you and your physician before you proceed, okay? Any questions on lung cancer screening? Yes? No, you don't get any. Unfortunately, we don't give you any screenings. But your partner, yes. But you can always talk about it. It also depends. But unfortunately, that's not part of the recommendation. It's really for those who have, mainly for like smokers. So yeah. But how long were you exposed to secondhand smoking? Oh, okay. It would really be a case-by-case basis if we can justify it. A lot of the screenings, of course, is covered by insurance. So if certainly it's something that you can discuss and see if it can be done, certainly. Any other questions? No? It doesn't have to be necessarily this, but you know, it could be related to the screenings. Yes, ma'am. Go ahead. Yes, that's true. Yes, yes, that's certainly true. Now, with screenings, at times we're not going to catch everything, but hopefully we can catch most. But there is certainly, because there are those who maybe work in certain environment where they're exposed that can certainly put them at risk. So, in situations like that, it's really going to be a case by case basis. Because, you know, if someone maybe came to me and said, hey, I'm working in this facility with, you know, these chemicals or I'm exposed, or let's take the second hand, for example. If I'm concerned or worried, I certainly probably would try to see if I can get some type of testing or screening done. And remember, these are recommendations. They're never a one size fits all. I'm probably going to be saying that a number of times. It's really a case by case basis. Yes, ma'am.
Does sleep apnea make lung cancer worse?
Not necessarily sleep apnea is connected to the lung cancer, because lung cancer said it can be, you know, smoking, or it could certainly be other factors that, you know, we don't even know, but it's not necessarily related in that way. Now, weight in itself can certainly make it worse, and also if it's not treated, but not, you know, if it depends actually. Any other questions? Maybe. Yes.
What's the difference between the HPV test and the PAP test?
So we're gonna go over. I'm gonna get to that one. But I can tell you now. So one is where we do what's called cytology. So you've had your PAP where you go and they use a speculum and they scrape some cells and they send it to the lab. Now there's additional tests that we can add on that starts like after 30, the HPV test, because we're looking for those high risk strands that can certainly cause like cervical cancer. So, but that's not until 30. One of the reasons is because in younger people, when you're exposed to HPV, the body tends to clear it. Yes. When you get that, a PAP with an HPV test done, which is after 30, you likely get plus with the HPV. You don't need to get another one until actually 5 years. But if you just got just a cytology where we just look for some cells, send it to the lab, and it comes back okay, then every 3 years. Now, I must say, I must say, it really, again, is a case-by-case basis, because I have seen where a lot of GYNs are just going to the 3 years. So I don't see a lot, you know, the guideline says this, but the guidelines are made to be interpreted. So I don't see a lot that's doing, you know, the 5 years when you get the PAP with the HPV test, okay? Any other questions? Yes, ma'am.
What's the maximum year to get HPV?
Not HPV, you mean like the screening? Or,
52.
yeah.
Can I still get the HPV?
You certainly can. If you had like a, you know, let's say for example, new partner, so you certainly can. Okay.
Planned Parenthood said no. Have to be 45.
No, are you asking about the vaccine, or are you if you can get the disease? Like,
HPV vaccine.
oh, vaccine 45, yes. But 45, you're gonna discuss with your GYN, and then you got shared decision making. You guys did. You can get it because you're 52 now, but the recommendation, which is of recent, is up to 45 now.
I can only get it.
No, not at 52. I'm sorry, I didn't understand your question. Yes, I think she had. Oh, you had a question. Go ahead, ma'am.
It seems like they're pushing HPV for teenagers.
Yes.
On all of the TCs.
So,
And why is that?
so it's because we now have the vaccine that helps to prevent cervical cancer. So maybe many years ago we didn't have that, but now with the vaccine, of course, we're seeing, you know, decrease in the cervical cancer. So we start early. You can do 9, 11, around that age group. You can start getting your HPV vaccine. Depending on when you start, it may be 2 doses or 3 doses. And believe it or not, it used to be up to 26, but now they extended up to 45. That vaccine is very, very effective. So that's why you see they're promoting it so much. So you may see it on the television, just like you probably see shingles on the TV. 1 in 3 people will get shingles. I always remember that. So yes, it's because it's been shown to be very, very effective in lowering the rates of the cervical cancer. Same with getting your routine PAPs all the time. Yeah. So remember, screenings, early detection, that's what we're focusing on. Okay? Yes.
Now back to my first
Yes,
question.
Fifi. We're
Okay,
almost
so
to the.
we're talking about early
Uh-huh.
detection of cervical cancer. So late life, 60, you're
Mhm.
saying that you should not get a PAP.
Okay, we're going to touch on that one, and I have that one in your handout, but I'm going to touch on that one, okay? So, mental health, we talked about the PAP. I'm going to come back to your question. And of course, 50s, 60s, we're continued our mammogram. We talked about all the vaccines. And now COVID actually changed. Yes, it's on the news. Now they're saying 65 and older for the COVID vaccine, or of course, if you're immunocompromised. So now, not everyone's gonna be getting the COVID vaccine. That's such a very new recommendation. So more information will certainly come out about that one. Now, don't ask me why it's changed to 65 because that's a very good question. You know what? It should lower your risk. It should you. I, I'm not gonna say you with any vaccine. You certainly can get breakthrough. You certainly can, but it should really lower it. Like the risk should be so low that you don't. Even if you were to get, you shouldn't have those complications. That should be lower. It's like how you get the flu vaccine, but you can still get flu, but you should get a milder form of the flu. But the thing with the shingles vaccine that's important is that it's not the rash we're worried about. It's the pain that comes after. Because remember, that shingles come in where the nerves sort of run. Okay? So shingles will come a particular area, and you can get that pain that we call that post-herpetic neuralgia. So that's what we're worried about. Because that pain can be, for a long time. And we don't know. Yes. Oh no, the rash. Nobody cares about that rash. Not anyone. We don't care about it. It's not the rash. It's what can happen. There's complications of it. And then if you have other conditions like diabetes, your complications may be worse with the shingles. If you have certain respiratory conditions with asthma, COPD, it certainly can be worse. Okay. You can still get it. And believe it or not, if I had shingles when exposed to someone who, never had chickenpox, they're not vaccinated, then they can get chickenpox. So that's another you want to, yeah, that's another reason why you don't want to get the shingles. Okay, all right. I did not forget your question, so hopefully you're holding on to it. So lifestyle tips, find fun ways to stay fit. This is very important as we get older. Because the more active you are, then of course functioning is certainly better as you get older. So low impact activity is fine. That just anything that keeps your body moving. If you like walking, you like playing tennis, you like swimming, yoga, anything that's going to keep your body moving is fine. And we talked about the weight. Sleep is important too. Making sure I get enough sleep. Make sure you have a good sleep hygiene. You're going to bed at a good time, waking up at a good time. Then that warrants a visit to your doctor to make sure you get evaluated. Make sure you don't have something like sleep apnea or another condition that's causing you not to be able to sleep. Stress, that's an important one. You know what? Stress affects our body and it comes out in so many ways that you probably didn't. Anxiety, that's another one. Yes, ma'am, go ahead. You know what? I'm gonna go over that at. Let's save that one till the end after we go through everything, okay? Since it's just a little bit of, it's more of a condition, a little bit different, okay? All right. Now, diet we talked about, and diet. You'll see diet a lot because diet, exercise is so important, and the stress management and the sleep. All right, 60s, 70s, and beyond. Okay. Yes. Is that your age group? Wow, I would have never guessed. All right. So the focus here is should be on maintaining function, sorry, and your health span. So that's why we talk about exercise, 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 and more exercise, a little bit of strength training to just keep those muscles, good diet, enough protein if you don't have any other conditions. So osteoporosis, and we continue with our annual mammograms. So here's where I can touch on that. When do we stop the annual mammograms? Anyone know, or what's the recommendation for the annual mammogram? It's not, no, 65 is too young. You're too young at that. 74 actually. So 74, but you certainly should discuss it with whoever your primary care doctor is, because if you want to continue getting screened, you certainly can. If you have risk factors, you certainly can, continue getting your screening. But if it's someone who's no abnormalities, we never found anything, then you certainly can. This one is going to be a decision. When you get to that age, that's going to be a decision between you and your physician. You want to continue screening. Some people choose to continue screening well into their 80s, but at 74, we certainly can stop the screening. Okay. All right. We talked to. It's not. It's. Remember, you and the doctor work together as a team. So both of you will come together. Maybe if you had a history, he might say, let's continue the screening. But, or if you've had every mammogram, it's been normal, you don't have risk factors, you're low risk, then you certainly, if you want to, end it there or stop there, unless something comes up and you want to get screening, you certainly can. But you guys always work together to, yes. But certainly we'll make recommendations. But again, it's really up to both of you. You will discuss that, okay? So a lot of these we've gone over, but we didn't talk about like assessment for memory disorders like dementia, Alzheimer's. You'll probably see that a lot in the news, a big talk. So there are screening tests that at certain age your physician can do, like starting at 65 actually, just to see how your memory is. And then if those, a lot of times we do screening test is positive, then that's an indication to do additional tests. So let's say you come, you get those screening tests done, it shows positive, then that would be indication for additional testing, okay? Any other questions? You're yes. You're gonna ask that question again. All right. So go ahead. Let's answer it now because no. Go ahead and for your question. When do you stop the screening?
When do I stop my screening?
All right. Good question. For the cervical cancer, PAP. Okay. Cervical cancer. So the PAPs, if all your PAPs in the previous 5-10 years were normal, 65, we can stop doing the PAP test. Now, if you've had a total hysterectomy, there's no reason to do anything. You got the cervix removed, so there's no reason. If you had cancer, though, let's say you had cervical cancer, stage 3, like CIN stage 3, then you may need, the risk for vaginal cancer is increased, or so you may need additional. But generally, if you've had a total hysterectomy, or if all your PAPs prior to that was normal, then we certainly can stop the screening. Now, let's say someone who's immunocompromised, HIV, you may want to continue screening because they're at high risk because of their condition.
So okay. Cancer in any other area than the cervical area, such as skin cancer or...
No screening for. If it was, yes.
If it was colorectal cancer, would you say screening is needed for cervical cancer?
It depends. If you've had total hysterectomy, again, no need for, cancer, but it depends on reason for the total hysterectomy. Let's say you just had it because you had like fibroids or something. No need for screening, but if it was because you had like uterine cervical cancer, then certainly you and your GYN can decide if you want to continue with further screening. So the colon cancer, I would say maybe a case-by-case basis if you need, one second, a case-by-case basis if you need like, any additional screening. Okay, So that was when do you stop? What's your, I don't know, we talked about the mammogram, when do you stop? And this lady over here has another question. Okay.
Oh.
You know, if you want to write it on in the end, we can, you know, you can ask me and then we'll go back over it, okay?
There's been an increase in measles.
Yes, there has been an increase in measles.
Is there anything we need to do
So,
in the 60s, 70s?
great question, because measles, you know, sometimes in children they have a very robust immune system. They might get measles and they do very well. They just bounce back. I'm gonna get to your question soon. But in adults, sometimes the complications that come with it can just be really bad. And the older measles vaccine was not as good as the ones we have now. So when you go for your annual, that's one thing you can ask your doctors to see if they want to check your measles titers, because if your titers is good, you may not need, you know, a vaccine. So I worked in New York, and you know, you have your my chart and tells you in red what you need to do, like you need an annual physical, you need a mammogram. That used to actually, because we had a measles outbreak in 2019, so it used to come up on there to say you should always do a measles. So because of that outbreak, you can, yes, yes. If you have a concern about it, I certainly say you can get the titers, because then if the levels are low for any of those, you can always get, you know, the vaccine. Yes, ma'am.
I was hysterectomy around 2015.
Pardon?
I was hysterectomy. Hysterectomy.
Oh, you had one. Okay,
Yes.
okay.
When do I stop seeing the gynecologist for
A,
pap smear?
a total, you everything removed? Do you know?
I think the cervical part is still there.
Oh, if that's still there, you should still, but you just have to make sure if it's total where everything is removed, there's no cervix there's no need to get the pap. But if it wasn't, then you should still be getting. So that's a great question when you go to your GYN, but just make sure that, you know, the type of procedure that you had. Like, just be certain.
So I still have it, cervical.
If you still, yes, the cervix catheter, we still need to be getting the pap, remember? Up until 65, yes. But that also, remember, is based on your condition. So remember we talked about if you had certain cancer, then you probably should still, you know, get your pap testing done. Any other questions? We're almost finished, and then we can ask all the questions. Hope I have all the answers. So Tdap, shingles, if you haven't already had, we talked about pneumonia. So here's the new one again. Oh, we have a lot of vaccines for you now. RSV. You've probably been hearing a lot of talk about this respiratory syncytial virus, right? But it used to be so much more. You're seeing it in common in kids, but of course in the elderly. So now we're recommending RSV vaccine if you're 75 or older, or if you're 60 to 74 and you're at higher risk for RSV complications. Okay, so you'll probably see more about, you know, that one. Meaning, like, if you are at high risk, you're immunocompromised, maybe you have some kind of respiratory, you know, problem that put you at high risk, maybe cancer that puts you at, anything that's gonna put you at high risk of getting the disease, but in a healthy person that probably doesn't have those conditions, it's probably not gonna be as bad. But let's say I have some conditions, I get it, I might get pneumonia, you know, have a bad pneumonia, so, you know, the vaccine will help to lower that risk, okay? All right, yes, ma'am? So it's a type of virus called respiratory syncytial virus that you can get. It presents a cold-like symptoms, very, very common in kids, but also elderly is at risk for it, okay? Elderly, those who are older. Yes, yes, yes. Go ahead. Yes, around the fall. But remember, it's for those who 75 or older or 60 to 74, but at risk. Yes, yes. So if you're healthy, 64, 60, 65, there's no need to. Yes, ma'am.
How does it compare to the pneumonia vaccine?
What do you mean, how does it? You know what? This one is a newer one.
Okay.
So, of course, you can't compare the two because they're like two different. Like pneumonia covers a lot of the strands of pneumonia that someone 50 and older probably would have gotten. but the RSV is a newer one, but it's still good. But then, of course, I would try not to compare the two because I think in terms of how effective it is, it's really like comparing apples and oranges. Since it's fairly newer, there's more studies that need to come out about it, okay? So in summary, we talked about blood pressure. Now, if you're healthy, you might not even need to get blood pressure checked like young, 20, once a year, maybe once every 1 to 2 years, it depends. But certainly if you have high blood pressure, you should get it more checked even more regularly. So this is just a summary of everything we went over. We talked about the breast cancer. So depending on which guideline or organization you're following, sometimes the screenings might vary. Like you might have what's called the U.S. Preventive Task Force screen that might be guideline might be a little bit different, like let's say the American Cancer Society, okay? So the mammogram, 40, we're gonna continue. One moment, at 74, we certainly can stop, but that's something you want to discuss with your doctor because if you have risk factors, we might need to continue with the screening. PAP, we talked about, you certainly can stop at 65. If you have had, if you're immunocompromised, or if you have had certain types of cancer, you probably want to discuss with your doctor if they want to continue screening beyond, because you certainly can. But that's the recommendation again. The colon cancer, we talked about all the colon cancer. One thing I did not get to talk about, if you have certain conditions like Crohn's, ulcerative colitis, any type of inflammatory bowel disease, you generally would get screening a little bit earlier. Average risk, we talk about other testing for the lady over here that asked, like the Cologuard, the yearly stool testing. All of which I would certainly say, again, if it comes out positive, you should get your colonoscopy, so you might as well get your colonoscopy. And then cholesterol screening, blood test, but now even if, let's say, cholesterol comes back, it's really high and you're not ready for treatment, there's other testing that, they can do, like what's called a calcium CT scoring to see if you have like plaque buildup, so you can further have the conversation again with your doctor to see with the cholesterol. Any other questions? Okay. And bone density we talked about. Okay. Yes, ma'am. Go ahead.
Sleep apnea, what is it?
Okay. So sleep apnea is where to make it very simple, let's say you go to sleep and you're not breathing properly like how you should be breathing. So somebody might witness you that, you looks like you're gasping for breath, like you're having these episodes where it looks like you're not breathing in your sleep. Or you're snoring all the time, so feeling tired all the time. So we want to send you to get what's called a sleep study so that we can, further evaluate, see if you have a sleep apnea, and then we make recommendations. Okay? Now, sleep apnea can put you at risk for a lot of things like certain heart rhythms, certain things can make it a little bit worse, weight, blood pressure. Pardon? When you're sleeping, but you probably won't notice it, if somebody else might notice it looks like you're not breathing anymore. And there could be a number of things. If you had any problem with the airway, it's certainly almost like it's closing up, like it's closing off. Okay? Any other questions? So diabetes, we talked about, get your screening. Did you have a question, man? Okay. And we talk about the skin. The skin is one a lot of people don't really get the screening done for. I've noticed that. All right. So I just threw this in there about diet, making sure that, you have a balanced diet. That's important too, because as we get older, our dietary requirements might change. Maybe you might need a little bit more protein, but if you have certain problems like kidney disease, you might not, be able to tolerate as much. But overall, I like this. I like to show my patients a plate method. Yes, I love that plate. I think I use it for everyone. And this my plate came out first for patients who were pre-diabetic or diabetic. But I love it. But there's a different one where all that green is half of the plate. But I always recommend it for my patients if you're looking for a balanced diet, portion control, Making sure you have all your vegetables, your whole grains, your protein, of course, your fruits. So this is one I always push. Avoiding like the processed food, the sugary beverages, um, and then physical activity. So your doctor should be giving you a prescription for exercise. Not really, but recommending it. Pardon?
What does the orange one say?
Oh, the orange one says healthy proteins, like lean protein, like chicken, your fish, your turkey. That's what we want you to eat. We want you to eat lots of fish if you, of course, you're not
What does the
allergic.
red one say?
Fruits. Yes. All right. Okay, the green one, vegetables. Okay. Yes. Um, Fitness, healthy. So physical activity, at least 150 minutes per week. So, hey, you could do 30 minutes a day, or if you really want to push it, you could do 75. Again, I always say make sure that you're cleared for your exercise because we don't want anything to happen to you. So yes, 150 minutes. If you're trying to lose weight, it may be a little bit more. Move. Yes, 100. That's your prescription. 150 minutes per week. Yes. We want you to keep moving. Keep moving, keep moving. Yes, see, there you go. Yes, move more, sit less. That's what. And remember, I want you to add a little bit of intensity. So, if you're decide you want to walk around the neighborhood, maybe you want to add a little bit of wrist weight, or maybe you can bring 2 water bottles. Whatever it is, we want you to add a little bit of intensity because we want to build a little bit of muscle and keep you live healthier and living longer. Any other questions? So, yes, ma'am, go ahead.
About that plate.
The plate, let's go back to that.
I just wanna say,
Uh-huh.
you gotta remember that fruits.
Sugar.
That's right.
Yes,
You
yes.
gotta watch this. 'Cause when I'm watching my A1C and I'm eating all these fruits, I'm eating healthy.
Yes. So, I didn't add it, but I have another my plate that I love, and it's the one with that red is green. So it's all vegetables.
But that's what I'm used to.
Yes. That's actually the my plate I like. I borrowed this one I like, but that's the my plate that I love. It's the one where half is vegetables, a quarter is your protein, a quarter is the whole grains. I love it.
Yeah, and also corn.
Oh.
Let's start the vegetable.
We're going to have you doing the lecture for the nutrition next, okay? Because you're doing so well. Yes. So, it's just a little visual to sort of help with the 64 ounce, but you have to, everything, it depends. It does say 64 ounce, but if you're someone, let's say you had congestive heart failure, your water requirements may be less because we don't want you to overload yourself with water. Okay? So that might be a little bit less. If I had someone here that was on dialysis, that might also, huh? Yes. Yes, that also might, varies, but on average, it does say, 64 ounce. Okay, any other question?
Well, the water, if you have a problem.
Or those 8 ounce.
If you have a problem sleeping, you gotta know when to stop that water.
Oh, yeah, because that.
Because that gets you up to bed.
So don't drink water close to bedtime, because then you'll be up, going to bathroom. You may want to do it earlier. Okay, any other questions or? Yes. That's up to you. You know what? I love your questions. That one is a little, it's personal. It's up to you. But I probably would not recommend coffee close to bedtime because then that caffeine is going to keep you up. So, yes, I would never recommend coffee close to bedtime. Oh, okay. So when do you drink your last one? At 3 p.m.? Oh, that's good. No problem sleeping, right? You don't feel like it's keeping you up. Okay. So, old saying, an ounce of prevention is worth a pound of cure. Yes. So that's why we're focusing on prevention and getting all your screenings so that we can catch things early, okay? We don't want to be fixing. There's a place for fixing, yes, but if we can prevent, then that's the best, okay? Any other questions or? Peart, Peart.
What hospital are you affiliated with?
Here, Inglewood Health, yes. Yes. I did, yes, I did work in New York in the past, in the Bronx, yes. So Inglewood Health has a lot of offices all over. So we have an office in Rivervale and an office right here in Inglewood down the street. Yeah. So they have offices all over. Jersey City, all over they have offices, okay? Any other questions? Yes, you
Care,
can.
is it go there for your preventative care? Is it
Urgent care?
Or would you only see a primary care?
I would recommend seeing a primary care. I'm going to tell you why. Because, you know, the urgent care is just to take care of, like, your quick, like, you know, you're sick, you have a cold, you have a cough, you can't get in with your primary care doctor, and then you can go to urgent care. But you want to have a primary care doctor because you want to be able to establish relationship with that doctor, and continuity of care is so important. Just imagine you see the same doctor for 10, 12, or however many years. They get to know you. They know all your health conditions. So then, you know, they can kind of tailor your treatment accordingly. But urgent care has its place because if, you know, if you're sick and your doctor's office is closed, then you need to go to urgent care. But then, or the ED, you should always be following back up with your doctor after. Any other questions? I didn't hear from the lady in the hat and over here. Any questions? Okay, okay. No other questions. You feel all your questions were answered? Okay. How do you feel about all your screenings? You're getting everything done. Now you have okay. Yes, yes. All right, you're welcome.